Hi, my name is Bala Magami. I'm a graduate student at the University of Texas at Arlington in the Nursing Administration program. And we are here doing our patient safety roundtable discussion. I'm here with Dr. Carl Vartian, our guest speaker. We want to briefly go over the objectives for this discussion. Objective number one is to identify 2 ways the electronic medical record and CPOE contributes to increased patient safety. Number 2 is identify 2 barriers to the implementation of CPOE. And number 3 is identify 2 potential safety concerns during a facility transition from paper to the electronic medical record. So thanks for joining us, Dr. Vartian. If you would, please briefly tell us about yourself, your background, and how you impact patient safety and care within the hospitals that you serve.
I'm a physician trained in internal medicine and infectious diseases, and was in private practice for infectious diseases for 20-40 years before going into hospital administration, and I'm now a Chief Medical Information Officer for the HCA Gulf Coast Division and a Hospital Chief Medical Officer for Bayshore Medical Center in Pasadena, Texas.
Great.
In terms of impacting patient safety, pretty much most of what I do has patient safety in the background, whether that is appropriate credentialing of doctors to make sure patients are being treated by people who are competent to do that, peer review, evaluations to make sure that the doctors have maintained that competence, things like infection control and medication safety, medication management, all of these really impact patient safety. That's really the driving force in terms of much of what we do throughout the day.
Okay. Can you talk to us about some of the benefits of CPOE and how that impacts patient safety in a positive way?
Sure. From the basics of CPOE, that is eliminating the written order and putting it into the computer, immediately you eliminate all of the problems of illegible handwriting. Used to be guesswork. What do you think this medicine is? What do you think this dose is? All of those issues go away with CPOE. The order is legible. It's complete. We have our pharmacists build it so that it's a correct order. When the doctor just picks it, they can't put in the incorrect strain if they pick what we call an order strain. And so that immediately impacts patient safety just by making sure you don't have any medication transcription errors, which was a huge issue before CPOE, between when the doctor wrote it and then it got transcribed into the record. You'd make a mistake. The wrong drug would be given, the wrong dosage, the wrong interval, bad things would happen. So all of those things go away with CPOE.
Great. And in your experience for a hospital that's transitioning from paper to electronic medical record, what are some of the big challenges that they face?
I think probably the biggest one is just the change. Most of us have been using paper much longer than we've been using computers. I think future generation will probably have it the reverse. They're brought up in the electronic world, and doing things on paper is actually cumbersome to them. On the other hand, most of our physicians were trained in a period where there were no EMRs, and so asking them to give a paper that they've been using for most of their adult careers and their lives to go to electronics is hard. Plus, any new skill you have to learn. We all learn how to read and write at a very early age, and we've been practicing for decades. All of a sudden you put a computer in front of somebody and expect them to be just as efficient, or they expect themselves to be just as efficient. It ain't going to happen.
Not going to happen. Okay. Do you think that there should be an increased push or effort towards universalizing and transparency for the electronic medical record, as in the doctor's office, the outpatient clinic, connecting and communicating with the hospital systems?
Oh, absolutely. You can imagine if you were trying to send an email or create a Word document from home or in your office or send it to a friend, and everybody had a different system and you couldn't communicate with one another because you had to code it in the way that the recipient could read it, which would mean you'd have to do it differently for every single recipient. So you can imagine how beautiful it would be if every system talked to each other and you could get the continuum of care. Just a case in point, just finding out what medications a patient is on. If you could have that information flow from outpatient into the inpatient, and inpatient back to the outpatient, that would be wonderful.
Great. And as it relates to patient safety, there are several published literature studies like the Institute of Medicine report, the LeapFrog report, that suggest a definitive link between CPOE and patient safety. Are there some additional studies that you know of that relate CPOE to patient safety?
I mean, it seems like there's a new one every month or so. There was a very large review earlier this year. I think it was in the Annals of Internal Medicine that essentially reviewed all the prior literature looking at papers that were either equivocal or didn't show really a benefit or any detriment. There's some that showed detriment, some that showed improvement in patient safety, with the vast majority of them showing improvements in patient safety. And the editorial for this article, I think it was by Dr. Mostashari, the former head of the ONC, pretty much concluded, you know, we've reached a time we shouldn't even be asking whether it makes things better. We should really be asking, if something isn't better, what did they do wrong? What was it, their implementation? Because the reality is there's so much data that shows that it improves things. If it doesn't, you have to look at how it was implemented and what processes you didn't anticipate or correct for ahead of time, because the paper world has never been considered safe, and so it's actually somewhat hypocritical to ask the electronic record to somehow prove it's safe when paper we have proven is unsafe.
Right.
So I think we've gotten past this really doesn't work. It's really more how you put it to use and implement it in hospitals that really creates the gain.
Okay, and for a nursing leader, an up-and-coming nursing leader, a CNO, how can they support the implementation of CPOE? What can they do in their hospitals to help with patient safety as it relates to CPOE?
I think it's repetitive nature of telling the doctors who may be holdouts why we're doing this, that in fact we have seen mistakes made in the past. We have harmed patients in the past with the paper records that somebody misinterpreted, or it was an abbreviation that shouldn't have been used. They got misconstrued as the wrong drug or the wrong dose. I think it's providing support for those doctors. They're not all that savvy with a keyboard. I think it's providing at the elbow help with nurses who understand the computer system but also understand the clinical care processes that the doctor is trying to learn how to navigate that bridge. And I think really it's just the support of the doctors, congratulating them when they successfully do something and helping them, doctor, how can I help you place this into the computer?
Okay. Thank you for your time. This is the conclusion of our patient safety roundtable discussion. We hope that you have gained some insight about how CPOE and the electronic medical records relate to patient safety.